If you are like 15 million other Americans, you may be taking a proton pump inhibitor or PPI for your stomach. Prilosec, Prevacid, Nexium, and Protonix fall into the third highest selling drug class in the United States. But are they safe for you to take long term? Today we'll be discussing just that. And if you stick with me until the end, I'll tell you how recent studies show that there may be a new reason for you to avoid these medications. Good morning, health-minded people. I'm Dr. Snow, and I help you treat minor health issues naturally. And I work with clients and their physicians to make sure that they are on the fewest medications necessary to ensure the best outcomes possible. It is estimated that Americans spend $20 billion every year on PPIs that they probably don't need and that may actually be harming them. Prilosec or omeprazole, the first proton pump inhibitor, was introduced to the market in 1989 by Astra AB under the brand name of Losec and was available only by prescription. It became very popular very quickly, so of course other drug companies had to get their piece of the pie, so they began cranking out their own slightly modified versions, including Prevacid, Protonix, Asifex, Nexium, and Dexilent. Why would we possibly need 6 medications that are nearly the same drug? And while these medications are important for people who have been diagnosed with gastroesophageal reflux disease or GERD, Barrett's esophagus, or Zollinger-Ellison syndrome, these diseases are rare and must be diagnosed by a physician who can appropriately monitor patients in the adverse effects of PPIs. Also, PPIs are very important for the treatment of peptic ulcers, but the duration of therapy is only a few weeks while the ulcer heals. Unfortunately, these medications went over the counter in 2003, and now they are being advertised as something you should take for heartburn instead of antacids such as Tums or Mylanta. One problem with this is while antacids begin to neutralize the acid in your stomach the moment you swallow it, PPIs take up to 4 days to work. Why would you want to wait 1 to 4 days for a medication to work for a problem you need relief from right now? And even though the directions on the box state that you should not take the medication for more than 14 days without seeing your doctor, since it's available over the counter, most people think it is safe, right? Well, the list of increased risk of adverse effects from PPIs include bacterial infections, including C. diff, stroke, hip fracture, dementia, mineral deficiencies, including iron, calcium, and magnesium, stomach cancer, vitamin deficiencies, including vitamin B12, kidney disease, and heart attacks. They can also interfere with prescription medications such as clopidogrel or Plavix, decreasing the effectiveness of this blood thinner and increasing your risk of a blood clot. Pletal or cilostazol taken with PPIs may cause heart arrhythmias. PPIs interfere with the absorption of some antibiotics such as cephalosporins, which prevent them from killing your infection. PPIs interfere with how your body eliminates citalopram or Celexa, possibly causing it to build up to dangerous levels. That doesn't sound very safe. If you need the medication and your physician has prescribed the medication, he or she is monitoring you for drug interactions and side effects to keep you safe. So don't stop the med without consulting your physician. But what about the people who don't follow the instructions on the box and take them day after day after day for months or even years? And if the FDA states that you shouldn't take the medication more than once a day and for no more than 14 days, why is it sold in a box of 42 tablets? I will leave a link in the description below to the FDA website that answers questions about how Prilosec OTC should be taken. If this information is important to you, please hit that like button. People take these medications for so long that they may have horrible rebound hyperacidity if they try to stop the medication suddenly. Hyperacidity occurs when the production of acid has been suppressed unnaturally for so long that when the PPI is taken away, your body overreacts and produces excessive acid, causing heartburn, regurgitation, and stomach pain. This convinces the patient that they must have the medication or suffer the consequences. At this point, the patient must be taken off the medication slowly over 1 to 3 months just to avoid these issues. Stomach acid is important, and unless you have an appropriate indication for using a PPI, you need that acid to help digest your food appropriately so that you can absorb the nutrients, vitamins, and minerals that it contains. It also destroys any bad bacteria or viruses that you might ingest with your food. And low stomach acid has been linked to leaky gut. Extended periods of acid suppression has been linked to anemia due to decreased iron absorption. Decreased calcium absorption can weaken the bones and increase the risk of hip fractures. And low magnesium levels may lead to muscle cramping and even a heart attack. Do you have leg cramps at night? Do you take a PPI routinely? Do you think there might be a connection? If this information is helpful, please consider subscribing to my channel. And don't forget to hit that little bell so that you'll be notified every Monday when I post a new video that's designed to help you navigate the sometimes confusing healthcare system. As I mentioned before, stomach acid is important to prevent infection because it kills bacteria and viruses that you may eat with your food. And because in the year 2020, everything is related to COVID-19, a group of scientists decided to look into whether or not taking PPIs could increase your risk of testing positive for COVID-19. Sure enough, they do, especially if the PPI is taken twice daily. One study showed a 6.4% increased risk for testing positive, but it did not report if the patients had more severe disease than those not taking a PPI. In a second study that was published in October of 2020, it was reported that COVID-19 positive patients that were taking a PPI did have an increased risk of developing severe disease, including pneumonia. It was suggested by the scientists that at this time, PPI should only be taken by prescription and under the supervision of a physician. If you have found this information helpful, but you want more information on the dangers of over-the-counter medications, click and watch this video now. Thank you for joining me today to learn about how safe proton pump inhibitors really are. Stay healthy, slowly get off of those PPIs, and have a blessed week.